And with cancer, it's just such an awful disease to have. And anyone that's listening that has either had cancer or knows someone that has had it, knows this is true. But also, I think, cancer, a lot of people think about it as one disease. Non-scientists, physicians, they kind of think about cancer as just this one disease, right? As you and I both know, it is definitely not one disease. It's hundreds of diseases. I'm curious on, first of all, we still don't have a cure for cancer. I mean, we've made a lot of progress, right, in different cancers and can be treated better than others. But can you talk a little bit about why it's been so hard to find a treatment for cancer?
Yeah, I think the important thing to clarify is that cancer is not one disease. It's probably 100 different diseases that have probably hundreds of sub diseases. Or subtypes, if you like. And in fact, certain cancers are 100% curable or 95% curable. Like some of the childhood leukemias, which were completely fatal, a couple of decades ago, are now, 90% or close to 100% curable. If you catch certain cancers early enough, again, 100% cure rates almost. So because it's a very, very different set of diseases, the cancer of pancreas is very different than cancer of lung cancer or breast cancer, or there are some cancers that are so slow, like if you get certain types of cancers, if you're age 80, doctors don't even bother to treat it because by the time unless we cure aging first, because by the time you die of aging, that cancer is not going to kill you. Aging is going to kill you first, or there's certain prostate cancers at a certain age. So that's why we have to really understand that this is a very complex biology. But more importantly, why cancer is such a challenge is that the cancer cells are part of us, right? So if you're infected with a bacteria or a virus, it can kill you, right? They're extremely dangerous. But we are able to recognize them as an enemy, as a threat, your immune system, and we can fight back. Not always successfully, but most of the time very successfully. And we can also target them very specifically. Like we have an antibiotic that will only act on the bacteria. It's not going to touch your normal cells because it's only a foreign organism. But cancer is not like that. So if I try to stop cancer with something, I'm also stopping some other cells that are normal, right? That's why people lose their hair. Their immune system is greatly weakened because the immune system has to divide. Your hair cells have to divide. So you block them because the cancer cell is also dividing. And your side effects of chemotherapy sometimes worse than having the cancer. Like hundreds of thousands of people die because of that. So the revolution in cancer was recently because of what we call immunotherapy. The question was, why can we make the immune system to recognize cancer as foreign threats? Like they're kind of like terrorists, right? So a terrorist, you will not know if that's an enemy or not. They look like you, they just come in and then they create... So the immune system is seeing it that way. It thinks that the breast cancer cell is not so different than a normal breast cell, like epithelial cell, whatever. And so it doesn't know what to do. If we could teach the immune system, or if we could remove some of the brakes that it has, the regulation, and let it recognize and attack the cancer cells, then that could have a tremendous effect. That was the hypothesis, and it actually worked. So cancer immunotherapy, I think, is more powerful now than chemotherapy and radiotherapy put together. I mean, they still have a role. And of course, the other thing is that how can we make the treatments very specific, right? So if I give a chemotherapy, that's not specific. It's like trying to hit the patient on the head and hope that the cancer will die before the patient dies. But if I know this single mutation that's happening on whatever, EGF receptor in certain cancers, I can develop a small molecule which will only act if there's that mutation on the EGF receptor or whatever. And so it's not going to touch anywhere else. It's only going to target in fact, people call them smart drugs, and they're extremely effective, right? So if you have that particular mutation, you're 1% of the lung cancer patients, you get treated with that drug, you get almost 100% cure rate. But again, we can make this even much better. So for example, immune system can be engineered, something that we work on in the lab, to recognize, like literally engineer. We take the cells out, we train them, we put genes into them, say, okay, so if this gene binds to a cell, assume that that's a threat and kill that. And so it's called CAR T therapy. And they will go and seek out whatever the cancer cells that have that marker and kill them. The advantage of that is that cancer doesn't have much way to escape that. It can try to suppress the immune system, but other than that, even if it mutates, the immune system will still recognize it and find that few cells that are hiding somewhere and destroy it. And that's showing incredible results. So the mRNA vaccines, which I think is going to be revolutionary, is on that basis, right? So, and that really personalized the cancer. So I have a breast cancer, but my breast cancer has certain type of mutations that other patients don't have. So even if the immune system can recognize X patient, it won't recognize mine because the cancer has different mutations. If I take those mutations and synthesize what's called RNA, and then give it back as a vaccine and train my immune system and tell the immune system, look, if you see these mutations in these genes, that's an enemy. Go destroy that. That's mRNA vaccine. And that becomes extraordinarily powerful because now you're directing your immune system to an internal threat just in you. And let's say the cancer acquired different mutations. You can create another mRNA vaccine and then train the immune system to that as well. I think that's those are the difficult parts, but we see the light at the end of the tunnel. Cancer is going to be 100% curable, probably less than a decade.
How is AI going to make that happen?
Yeah, so in fact, it's already making that happen. You probably heard of this story from Australia. This computer scientist had ChatGPT and some other AI models to develop an mRNA vaccine for his dog. His dog had, I think, a melanoma, and he got it sequenced. He took the sequence and gave it to an AI model, and the AI model designed the precise mRNA molecule that the dog's immune system needs to be trained. Got it synthesized, and I think it was able to apply it in 3 months. Probably could have been shorter if there wasn't regulations, and the tumor started to regress, and the dog was alive when it was supposed to die. So, I mean that's a very obvious and simple version, but because there are hundreds of different of cancer types, you can imagine that we'll have maybe 100 different treatments for just the type of a lung cancer. Some will be mRNA, some will be small molecule targeting that. So to be able to develop those on demand or very, very rapidly, we're going to need AI. So the AI is going to model every possible mutation and will screen millions and millions of compounds. And so we'll get to a point where we'll have hundreds of new drugs coming out every month, maybe, and this 1,000 drugs is for breast cancer patients. But, if you have this and this mutations, and if it's stage 4, then you take this combination. If it's that, you take this protocol.